Hi everyone, welcome to Dental Exam Guide, and today's video is on one of the most important topic, tooth numbering system. You can get both essay questions and short notes from this topic, and previously asked essay questions are discuss various tooth numbering systems, narrate the dental formula for permanent and deciduous teeth, which we have already discussed in our previous video. And the second one was explain the systems of dental notation with examples. And the third one was enumerate the different tooth numbering systems with a note on its importance. Sigmondy Palmer system, FTI's two-digit system, and universal numbering systems are commonly asked short notes. Tooth numbering systems are the system used by dentists to associate informations to a specific tooth. It was difficult for the dentist to describe the type of dentition, dental arch, quadrant, and tooth name in words. So it made the dentist to adopt a type of code or numbering system for each tooth. So we can say it was developed in order to have a standard way of referring to a particular tooth. Tooth notations acts like a dental shorthand. It provides a standard and easy way of communication among dental professionals, students, care providers, and anthropologists. It also gives a convenient method of record keeping in dental practice. There have been more than 32 different tooth notation systems in the world, but only 3 systems are commonly used. That are Sigmondy Palmer system, universal numbering system, and two-digit numbering system, which is proposed by FDI, Federation Dentaire International, or World Dental Association. Let's have a look at the history of tooth numbering system. Years ago in Europe, the notation of tooth was based on Latin and German, but the names were lengthy. Later, in 1861, Adolf Sigmondy of Vienna introduced a new symbolic system for permanent dentition, and it was originally termed as Sigmondy system. And in 1870, an Ohio dentist called Palmer also invented the system independently. So the system came to be known as Sigmondy Palmer system. In 1874, Sigmondy had modified his system for primary dentition. While he introduced it for the first time, it was only for permanent dentition. And in the year of 1947, it was recommended as the numbering system of choice by American Dental Association. Palmer was a dentist from Ohio, United States. So Sigmondy Palmer notation is most commonly referred to as Palmer notation system in United States. Due to the difficulties with the keyboard notation of Sigmondy Palmer system, in 1968, ADA officially recommended the use of another system, it is universal numbering system, which was proposed by Paris in the year of 1882. Many other systems were also there in use at that time, but they were not officially recommended, and few among them are Hillischer system, which used colons and semicolons to distinguish the primary and permanent tooth. Next one is Mons dubois system, which used even numbers and odd numbers to represent the right and left quadrants respectively. Another one was Victor Hederup system, which used plus and minus signs to denote upper and lower quadrants. Both the systems, that is Sigmondy Palmer notation and universal notation system, which were officially recommended by American Dental Association, had some disadvantages because they did not comply with the requirements which were set by FDI, World Dental Federation. So in 1970, FDI introduced its own two-digit system, and it is a system used by World Health Organization. FDI system is used by most of the countries in the world except USA, where universal numbering system is used, and UK, where the old Sigmondy Palmer notation system is used. So FTI system is the most widely used system internationally. Most recently proposed system is MyCap notation, which is proposed by Akram et al. In the year of 2011. So that's all about the history of tooth numbering system. So we have seen the tooth numbering system was developed for an easy identification of the tooth, to provide a uniform pattern all throughout the world, and to make recording of the data on a case sheet easy. General rules in numbering and naming of the teeth are: oral cavity is divided into 4 quadrants by drawing 2 lines through the midpoints horizontally and vertically. And the quadrants are numbered as 1, 2, 3 and 4, and there will be 2 maxillary and 2 mandibular quadrants. Next is about the Sigmondy-Palmer notation system. It is also called as symbolic system, quadrant system, grid system or angular system. As I said earlier, it is the oldest system in use, which is proposed by Adolphe Sigmondy in the year of 1861 for permanent dentition, and later he modified it for the primary dentition. And it was the most commonly used system in much of the 20th century. Later in 1870, Palmer also invented the system and he published it, and it came to known as Sigmondy-Palmer system. And in 1947, ADA officially recommended its use. In Sigmondy-Palmer system, mouth is divided into 4 sections called quadrants, and it uses a grid to depict in which quadrant a specific tooth is found. In the grid symbol, vertical line segment indicate the patient's midline, and the horizontal line indicate the occlusal plane that separate the upper and the lower arches. Counting always begins at the midline and it progresses backwards. For permanent teeth, beginning with the central incisor, the teeth are numbered from 1 through 8 in each arch. And for primary teeth, beginning with the central incisor, the uppercase English letters A through E are used in each arch. And the symbols used to denote the quadrants are: first one for maxillary right quadrant, the second one for maxillary left quadrant, the third one for mandibular right quadrant, and the fourth one for mandibular left quadrant. I will show you the examples of how maxillary right central incisor, maxillary left central incisor, mandibular right central incisor and mandibular left central incisors are represented by Sigmondy-Palmer notation. Sigmondy used Roman numerals to number the teeth from midline for the deciduous dentition, and Palmer changed this to ABCDE to reduce the confusion and errors in interpretation. While numbering the permanent dentition using Sigmondy-Palmer notation, the number 1 is central incisor, number 2 lateral incisor, 3 is canine, 4 is first premolar, 5 is second premolar, 6 is first molar, 7 second molar and 8 is third molar. And in deciduous dentition, capital letter A represents central incisor, B for lateral incisor, C for canines, D for first molars and E for second molars. Advantages of the system was it was simple to follow and it was user friendly compared to the systems that were previously used. It can produce a very graphical image of the dentition, and the tooth transposition or edentulous spaces can easily be depicted. Disadvantages are difficulties in keyboard notation. It is difficult to create the grid symbol and it requires a special software. And it is difficult to dictate or it is difficult to use for verbal communication. Another disadvantage is there is no provision to code a supernumerary teeth. Hederup system. It is a numbering system which is similar to Sigmondy-Palmer notation system. Here, upper and lower quadrants are denoted with plus and minus signs respectively. Plus or minus sign is placed on the left side for the left quadrant and it is placed on the right side for the right quadrant. And for primary dentition, 0 is added to the left side of the numerals. and this system is still taught in Denmark. Compared to sigmondy Palmer system, it is computer friendly, but it can be very confusing for recording of the mixed dentition, and it's very difficult to dictate, so it cannot be used routinely.